So it's Mari McInerney from Croaky here, and I'm at the Oceania Tobacco Control Conference in Perth, and I'm talking to Professor Emily Banks about your presentation. Can you say what your role is and what your topic was today?
Okay, so I'm a Professor of Epidemiology and Public Health, and I work at the National Centre for Epidemiology and Population Health at the Australian National University. And my talk was on the first large-scale direct evidence we have about the relationship of smoking to premature death in Australia. So I think what's interesting about my talk is that Australia's been an absolute world leader in tobacco control for decades, and in many ways tobacco control is one of our greatest exports. But we have not had direct evidence about the effect of smoking on death rates in Australia until it was published in February this year.
Why is that we haven't had that?
Well, in order to really look at the relationship of smoking to death rates, you need a very large study and you need to follow large groups of people over time. So you need a very large study where you've asked people about their smoking behaviour and then you follow them up for death. We basically didn't have that on a large enough scale. So the work that I presented was based on the Sax Institute's 45 and up study, and that study is where there's around 250,000 people aged 45 and over in New South Wales who filled in questionnaires, including about their smoking behaviour, but a range of other things. And they've been followed up through data linkage for when they die, well, whoever's died over the follow-up period. So what we did was we took around 200,000 of those people, and they were people who told us about their smoking behaviour, and we had all the information we needed on them, and we followed them up over a 4.5-year period to see who died and who hadn't, and then we compared the death rates in the people who were currently smoking at baseline, people who had never smoked, and people who had smoked in the past. The main finding from that was if you looked over that 4.5-year period, the people who were current smokers were 3 times more likely to die than those who had never smoked. And the people who are previous smokers were around 30 to 50% more likely to die over that time. So that essentially means that around up to 2/3 of smokers in Australia can be expected to die from their habit if they don't quit. And that's actually quite a big change in terms of what was known about smoking here. We had made assumptions that it was around half of all smokers would die from their habit, but we now know it's up to 2/3.
And that was yours, wasn't it? The idea that the risk factors, that was a very interesting thing, that it used to be 1 in 6 would die, and now you're saying really basically it's 2/3, and that has implications in a number of ways. How does that work out?
Well, the thing is that the way that smoking works in populations is you often see what we would call a kind of evolution of risk. So when smoking is first introduced to a population, people start smoking fairly late in life, they might not smoke particularly heavily, and they haven't smoked for a long duration. So if we look at the risks related to smoking in the 1960s, it was about 1 in 6 smokers would die from their habit. When we got to around the mid-1980s, it was around half of all smokers would die from their habit. And now, when we look at smokers now, they essentially all started smoking in their teens. They've been smoking for quite heavily for a long period of time. And so we actually see this sort of true realisation of the risks of smoking. The other thing is, over that time, we've seen a lot of health benefits that have happened in the non-smokers, so their death rates are improving. But what I was saying to the audience was essentially this evolution in risk. It's as if during the 1960s it was like throwing a dice. 1 in 6 smokers would die from their habit. In the 1980s, smoking was like tossing a coin. It'd be about half. And now we're at this point where it's 2/3. So you could sort of argue that the odds are against you. It's sort of house wins is probably the easiest way of putting that. So to say that, and that I think is quite an important shift in the balance. I think for people who are smokers, what this now says is you're unlikely to get away with it, but it also highlights the benefits of quitting, because it means if one person stops smoking, the chances are you've saved a life.
So what are the implications of your study, particularly for individuals, but also for government? What do we need to do? And could I ask in the context too that you said it was actually quite difficult to get funding for such a study because everyone presumed we know it all?
Well, it's absolutely true. When I started doing this work on smoking and mortality, the main response people had was, well, look, it says it on the packet. Why would anybody research that? So if I were to apply for a research grant that says I want to look at the relationship of smoking to death in Australia, I would be pretty much laughed out of town, I think. So, and yet, it's actually an area where there was a lot of policy need. In fact, I would say there was a kind of policy hunger that actually we didn't have data directly from Australia that told us about the impact of smoking on our population. One of the important findings we had from that too was this gradation in risk according to the intensity of smoking, so that among people who had smoked fewer than 14 or fewer cigarettes a day, their risk of dying prematurely during that 4-year period was doubled. So that was people smoking an average of 10 cigarettes a day. And those people tend to think of themselves as light smokers. But in fact, that risk is equivalent to the risk of being morbidly or severely obese, so a body mass index of 15 or of 35 or more compared to someone who doesn't have a raised BMI. Or it's the equivalent of drinking a bottle of vodka a day in terms of your risk of dying prematurely. But those people who smoke sort of 14 or fewer cigarettes a day would generally not think of themselves in that risk category. When you get up to sort of 25 or more cigarettes a day, it's around a 4 to 5-fold increase in risk, so it's really quite large. In terms of the policy implications, I think it helps policymakers in terms of how they frame their message. They can actually say, right, we now have data from Australia to really quantify that risk. We also have information that tells us that the consequences in Australia are probably worse than we thought, and so that in a sense allows a greater policy prioritisation. I think it's also helped practitioners in the message that they give smokers. They say, like, we've got information now, we've got information from Australia, and that actually means that, you know, we know for the people in the community in Australia who smoke, these are likely to be the risks. The other thing is I find that the data are being used in lots of different ways that I hadn't quite expected. So there's someone called Dr. Bronwyn King, who is a radiation oncologist who discovered that her super fund was investing in tobacco. And this is in the context of her working on a day-to-day basis with people dying of lung cancer. So she was really concerned about that and convinced that super fund to divest from tobacco, to stop investing in tobacco. And since then, she's convinced 28 different super companies to divest the equivalent of $1.3 billion in tobacco. And I met her at a meeting and she said, I use your results every single day because now I have evidence directly from Australia to convince these companies about what damage this is doing to the Australian community. So that's a sort of another angle on it. But I know that it's used by people working on quitlines. It's becoming much more part of the common language. And I also know when one article came out saying that people who quit smoking have a small increase in weight, that in the dialogue about that paper was countered by, yes, but it's known to kill 2/3 of people who do it. So it is sort of being used in a way that it's sort of gradually becoming accepted as that is probably what the situation for Australia is.
Well, it's interesting. You said you got a lot of media coverage for when the findings came out, but it wasn't necessarily always what you wanted. Were there some sort of, people there was something about people going, oh, excellent, I can smoke till I'm 45.
Yeah. Well, one of the findings we had was that if you quit smoking prior to the age of 45, you've avoided a lot of the excess risks in terms of dying prematurely. So there were people who went, wow, 45 is the magic number, I can smoke until I'm 45 and then I'll stop. But I think that what people don't appreciate there is that there are health risks that aren't just dying prematurely. There's things like the risks relating to fertility, to pregnancy. There's also damage that happens to your lungs over that time, and there's damage in terms of your fitness. We've been looking at some work, for example, relating to erectile dysfunction, and smokers are more likely to have problems getting erections. So there are a number of other health risks that aren't really captured in that just plain whether you're going to die young or not. And that's obviously important, but these other risks in terms of your overall well-being are also really important.
You said that you would love to get to a stage where we all go to the pub and brag about Australia's success in tobacco control. What would you like to see, and why is it important? Well,
I was saying that in my talk because what a lot of people don't realise is if we look in the sentinel age group, aged 35 to 69, worldwide, there's only one country doing better than Australia in men for their overall death rates, and that's Iceland. So we're actually winning. We are winning. We are world champions in terms of our overall death rates, but nobody knows about it. They know who won all the different rugby things and cricket, and they'll know all the Ashes statistics for the last 10 or 20 years. But they don't know those statistics. They also don't know that we've had an 80% drop in cardiovascular disease death rates since 1968. That's as if we've won the Ashes every single year since 1968 in terms of our absolutely brilliant achievements there. But there isn't a consciousness of it. And I think that one of the issues that arises from that is that people are quite susceptible to potentially misleading health messages. They might hear, oh, well, actually, everything we've been doing so far hasn't been very good. But if you knew that we have won the Ashes every single year since 1968, and someone came along and said, well, look, the coach isn't up to much and the fielding could be better and the batting's terrible, you wouldn't believe that if you knew the background success. And so I think that I would just love it if you could go down to the pub and go, oh, well, Japan was doing better than us until the late 1990s and we overtook them, and now, well, it's probably our better control of tobacco and better control of blood pressure and statins, and it's also better treatment of heart disease, and then, oh, but the New Zealanders look like they might be gaining on us, maybe we've got to do more about, if we could understand those statistics, but also understand that we are part of the team, we are the people making those achievements, I think that would be terrific.
I think you could get funding for that. Thank you very much for your time. Fantastic.
You're welcome.
To hear your presentation.
Lovely talking to you.